It was announced by the Minister of Health, Dr. Frank Anthony, during his COVID-19 update on a Thursday that the government is presently engaged in negotiations to procure COVID-19 vaccines for children.
We have been working with a number of partners to get vaccines that would be appropriate for children. Of the vaccines that have gone through clinical trials, there are only 2 right now that has been given emergency use authorization for children, and that is Pfizer and Moderna.
Data taken from a 2,000-plus sample size in 2020 showed that the Pfizer vaccine is 100% effective in preventing the COVID-19 virus in children ages 12 through 15. In late 2020, the U.S. Food and Drug Administration, FDA, allowed emergency use of the vaccine for children starting at age 16. This year, the vaccine was given to children in the U.S. from ages 12 to 15. Less than 2 weeks ago, a 16-year-old boy who was diagnosed with COVID-19 in Guyana died. More so, an estimated 7 children were admitted to the COVID-19 intensive care unit, a phenomenon the minister had attributed to the presence of the Delta variant in the country. President Irfan Ali, in an interview a week ago, also stressed on the importance of getting children vaccinated in an effort to reopen schools and revitalize the country's plummeting education system. Taking cognizance of this, the Minister of Health has assured that the government will be working assiduously to procure these vaccines for the nation's children.
Some countries it is being used for this population. So we are in negotiations to see whether or not we'll get those vaccines. And when we get those vaccines, we want to offer it to the children population.
Additionally, as the country anticipates the arrival of some 150,000 doses of the single-shot Johnson & Johnson vaccine being manufactured by the United States next month, the minister has assured that all systems are already in place to ascertain proper storage of the vaccines upon arrival in the country.
With the J&J vaccines, once it arrives here, we have an arrangement in place where our refrigerated trucks would pick it up from the airport. We move it to the bond. We have several facilities where we can store it at the appropriate temperature, and from there we'll then be able to distribute it.
Dr. Anthony had previously stated that once the vaccine arrives, its use would be directed to persons residing in the hinterland regions of Guyana, since many in those communities are more difficult to reach. Further, with regards to pending receipt of 84,800 doses of the AstraZeneca vaccines coming from the United Kingdom as part of the first batch of the 100 million doses pledged by the UK to get the poorest parts of the world for those population to be vaccinated as a matter of urgency, the minister said that the distribution of these vaccines will be used predominantly in the hinterland communities since they are easier to store. Meanwhile, in providing a statistical report on the country's present vaccination number, it was revealed that a total of 249,908 have received their first dose of a COVID-19 vaccine, whilst 136,919 persons are fully immunized. Reporting for the HDP Nightly News, Kendell Richmond.